The very warm and amiable people of Delta State, South Nigeria, have in the last 4 years witnessed societal growth and progress. This progress, which has in turn triggered a joyous state of mind amongst Deltans, has been largely due to the positive transformation of all sectors of the state.
Dr. OKOWA'S, our governor, has impacted the lives of Deltans in terms of medical facilities and good health facilities, in terms of road infrastructural development, everything, and even human capital development.
He believes that allocation of resources should be evenly distributed throughout the state by infrastructural development. He has created rules. He has invested heavily on health. He has invested heavily on education. He has uplifted Delta State from a low level to a very high level.
With the electoral victory of Governor Okowa and his deputy, Kingsley Burutu-Otuaro, to preside over the affairs of the state for yet another 4-year term, majority of Deltans have been in a celebratory mode. The solemn pledge by the duo to abide by the Constitution of the Federal Republic of Nigeria and to do good to all manner of men have been viewed by many as a commitment to deepen the pervasive infrastructure upgrade across the state.
The oath of service that I just took is more than an official function or constitutional requirement.
For the 4 years he has served, he made us proud. They're involved in infrastructure development, human capital development, peace agenda, all his agendas. He really meet up our demand.
There's no sentiment in all he has done. It has been an all-inclusive government. The man has actually done well. In the area of development, it's even development we have seen all over the place. We haven't seen this kind of governance before. So we really thank God at this time using him to be our governor and our leader at this point in time.
With the inauguration done and dusted, Deltans can beat their chests with renewed confidence as no one is left in doubt about the upward trajectory the administration is headed. It is on record that one very critical sector of the economy the Okowa-led administration has left indelible marks is in the health sector. The universal health coverage was the main plank of his health policy thrust, and it has ensured that Deltans are guaranteed availability, accessibility, and affordable healthcare services for all, irrespective of social-economic status.
On health, OKOWA has done marvelously. I can give instance of 3 or 4 ladies that get pregnant. They all go to antenatal free, gave birth freely, no payment. There are some accident cases I witnessed. When he came or he here, he will order to pay for the bills. So in terms of health, OKOWA has done marvelously.
If you go to our public hospitals now, there's some sanity, there's some decency, there's some sense of belonging right now. Not as it used to be. I want to appreciate him for what he has done.
The smart initiatives of Senator Okowa in the health sector is on course and is being pursued vigorously through the Delta State Contributory Healthcare Scheme. The laudable policy, which is a healthcare financing program, enables individuals or group of people make monthly or yearly contributions for their healthcare cost, thereby giving them access to a defined package of quality healthcare service anytime they need it.
The job of Constitution is to monitor, provide policies, make sure that this care is provided as at when due, affordable and good enough to meet the goal of government.
Generally, people don't save for their health. And so when the governor brought the idea, Labour bought into it because we felt like cooperatives and others, it was nice. When everybody contributes, individuals can now be free to access health care.
If the government was not sincere and they brought people who are not interested in making the scheme succeed, I'm very certain that the scheme will not succeed.
In line with the directive of Governor Okowa, Dr. Ben Ikechika and his team have traversed the 3 senatorial districts, reaching the unreached with special focus on the poor and vulnerable, even in remote creeks of the state. On account of this grassroots approach, no fewer than 100 primary healthcare facilities have been built, revamped and equipped across the 25 local government areas in the state by the administration.
He is a medical doctor, and that has added value to what he has done in the primary health care. If you look at the state of our hospital before he became the governor and what it is right now, he has done a lot, particularly in the teaching hospital and the specialist hospital. He has done very, very well. Because of his medical background, he's been able to improve the health sector so much.
Any health center, they don't pay money. You born free, you take medicine free, everything free. But me, they pray for him that this tenure, he will do more than that again.
At the last count, registered beneficiaries as at May 15, 2019 stood at 530,664 enrollees on the scheme, and many more are being reached daily. The Commission is doing its best at every step of the way to ensure the smooth operations of the scheme for the overall benefit of Deltans.
The Commission has staff in all the health facilities, ensuring that things are done the right way, so nobody is shortchanged. And of course, we have our call lines, which are on 247 for enrollees to make their complaints.
The Governor, Senator Dr. Arthur OKOWA, has done creditably well in terms of health care, particularly the introduction of the contributory health scheme, which has actually reduced drastically the cost of health care in Delta State. And of course, he has built quite a lot of health centers and improved on hospitals. And I'm sure other states will emulate from what he has just done.
The solid partnership between the state governments through the Delta State's Contributory Health Commission, the Bank of Industry, other financial institutions, and the Farm Access Foundation has no doubt paid off, as this collaboration is yielding the desired dividends.
Government is putting in a lot of money into the scheme. But you see, one of the things we have realized is that government cannot do it alone. We need the intervention of the private sector, also in facilitating the demand side of this. So, how can you look inwards and work together with the Delta State Contributory Commission and say, how do we create a system? How do we create a fund that will facilitate and enable more people to access quality healthcare and reduce mortality indices?
There has to be a lot of relevance and accord that should go to the consortium that made this possible. That is the Delta State government, the Delta State Health Contributory Commission, Farmers Access Foundation, and the Bank of Industry. This consortium came together to create a scheme that has really never been done before in the Federal Republic, and the success is being shown here.
A goldfish, they say, has no hiding place, so it didn't come as a surprise that contributory health scheme has been implemented by the Delta State government, gained recognition and won national awards for its potency in healthcare delivery services in Delta State and by extension, Nigeria.
In the country, I must tell you that this scheme is actually leading NHS, which is his senior brother. Because what NHS have not been able to achieve, the scheme has achieved. And winning awards, this is just the beginning. The Vice President gave us the last award from World Bank, from different places. It's just the beginning. Just recently, the NIFC people came here to understudy the scheme, and they were full of praises.
Still not relenting, the OKOWA-led government indeed has continued to provide reforms that have seen to the upgrade of healthcare services in the state. Hardly had they resumed work for the second tenure did they hit the ground running by helping to bring on stream a world-class sickle cell referral center at the Asaba Specialist Hospital, only second to the center in the Lagos State University Teaching Hospital, Luth. A vision of the O5 initiative birthed by his wife, Dame Edith Okowa, complementing the SMART agenda in the healthcare delivery. This brings the total sickle cell clinics to 13.
I commissioned this sickle cell center to the glory of God, in the name of God the Father, God the Son, and God the Holy Spirit.
Every one of these clinics is fitted with modern equipment, quality furniture, and manned by skilled and knowledgeable personnel. Our conviction that people with sickle cell disorder can live normal lives once they can easily access specialized health care provided by professional and compassionate caregivers motivated us to establish these clinics.
Sometimes I ask my wife, are you not putting too much pressure on these people? Because every one of those clinics have been established with the money of persons. Majority of them within Delta and a few from outside. And I thank each and every one of them, Senate Bank Chairman and many other persons who have donated generously to create a center that can impact on the lives of people.
This referral center will go a long way in creating the awareness, how people view sickle cell, people knowing their blood group. And I think it will go a long way in saving lives.
Previously, when you want to do things like a transcranial Doppler ultrasound, which is available here, you have to send the patient to Lagos, which is another place where it's done. So patients now don't have to travel the distance, don't have to pass through the stress. It's readily available in Delta State.
The contributory scheme has helped survivors of sickle cell disorder live better lives, and they are happy to share their testimony.
I will start by appreciating Her Excellency. She has taken the burden beyond where anybody have ever done before in this state or even in this country. What she's putting in place now is out of compassion of the feeling of those that are passing through it to bring relief. So I think it's strongly in line that with that, they will get a relief.
In fact, it's God that brought her to this club. I am a living testimony. I'm enjoying the free drugs that they are giving to us.
Smart Delta. Hey, welcome to Delta. Governor, where they want to go.
Hi, my name is Fretless, and I live in Asaba, capital city of Delta State. As an entertainer, my job entails a lot of movement from one place to the other, and also to be at the right place at the right time, meaning that I need good roads to be able to meet up with work or appointments. And with the new government reform on construction and rehabilitation of all major and feeder roads in the state as part of its smart agenda, it has become so easy for me to move around at all times. Now, I just cruise from street to street, city to city, all over the state. And even apart from the roads as I move along daily, I see magnificent projects everywhere. Check out this one in Warri and several other places. Wow. Governor OKOWA is indeed a man with a vision.
It is a known fact that rural and other remote communities face significant challenges accessing healthcare services, worse still when it affects riverine communities. Life in these parts of the state can be most challenging as the majority of dwellers have fewer options left. Oftentimes, they cannot afford the cost to hire boats and reach the mainland in the event of emergencies that most times lead to preventable loss of lives.
Life here had been very, very dull. We died prematurely. Pregnant women die. Before you rush them from here to Sapele, Warri, Eko, and so forth, they had died. This, to me, is one of the most important things that I have been yearning for. And the listening governor, in person of OKOWA, has done it.
This is something we don't expect. I'm happy in my time. I saw such a thing. Where you will pay hundreds of transport to Warri Sapele is here now.
The twin communities in Egbema Gbaramato Kingdom, Polobubo in Shekeleu and Oproza suffered such fates for decades until most recently. To change the narrative, the OKOWA-led administration took the bull by the horns to bring succor to their lives by taking healthcare to their doorsteps and in the process checkmated rural-urban migration.
Now that this hospital has been established in this community, it will be of benefit to the women of this community and to the youth and to the elders of this community. It is a welcome idea and we appreciate the effort of the government.
Before you go general hospital or past break clinic, you go register. Before you go take drugs, sometimes they go call like 30,000, 20,000 for you. Me, I know what time they pass through. Everybody to give you free treatment, I appreciate. God go bless on more in Jesus' name.
After the commissioning of the two healthcare facilities within the first quarter of 2019, the team moved in to equip them with necessary equipment to effectively run the hospitals. Today, the facilities are testimonies for themselves. The team regularly visits to ensure the smooth operations of the facilities. On one of such visits, the Director General, Dr. Ben Nkechika, members of his team and the Smart Delta crew meandered through the creeks and hamlets to access these communities and monitor implementation of the scheme.
Have you ever wondered why Governor Okowa is dear to the heart of Deltans? It's because he has placed the health of Deltans above every of his policies and programs to ensure that Deltans live healthy. Come with me as we see some of the projects in the health sector.
The team was surprised to see large turnout of people afflicted with various ailments taking advantage of the scheme to access Medicare. The environment was quite welcoming. There was sparse supply and water flowed freely from the taps in the overhead tank. The medical officers were at their best attending to individual cases while others patiently waited for their turn. The wards had a good number of people on admission, from the women's ward to the male ward and to the children's ward. The patients were indeed glad.
The very day when I came, they gave me a medicine. I go back. Also, my children, when I carry come, they give us medicine, we go back. Governor, we thank you. What you bring to us here?
Everything here is good. This is one of the best hospitals the government has made to us.
This facility is working very fine. We have enough patients there. I'm enjoying the works too.
The pharmacy was another spot to visit. It was stocked full with all kinds of drugs and other consumables. As such, there was no one who was asked to go home as a result of out-of-stock syndrome of drugs. Efforts to reduce maternal mortality have included initiatives to encourage more women to deliver at health facilities. The practice where pregnant women continue to patronize quacks and so-called birth homes is being discouraged to avoid preventable losses. Dr. Ben Ikechika and his associates gave insight into how they have handled the issues of enlightenment.
We realized that there was an increase in infant deaths as a result of post-circumcision tetanus, and that had been a problem. We even noticed that a lot of young men in this village were not circumcised because of that, and we immediately swung into action, talked to them, encouraged them to be bringing their children after delivery for tetanus, for circumcision, and with that they've started now becoming confident that a place where they get an antenatal service, a place where they get circumcision service and their children survive is a place where they should deliver. And based on that, the delivery rate is increasing, and we're expecting that we're going to achieve a success rate with infant mortality reduction in this community.
The next port of call was OKOWA'S Primary Health Care Facility. The road leading all the way to the palace was serene, and most importantly, the people were welcoming. Upon our arrival at the health facility in OKOWA'S, we took a quick tour around the facility, and we were pleasantly surprised at the transformation that have taken place in just 2 months of operations. We saw well-equipped theater and labor rooms and laboratory with modern and standard equipment. So also the nurses' station as well as doctors' consultation rooms. The general level of hygiene also was commendable.
Since this hospital came, people have been talking so much about that they work in a good way and they do several operations. We, the people that live in riverine area, will benefit from it because it will save us the stress of driving down here to Warri. We want to thank the governor and the rest of people that put effort to make this place improve. May God richly bless them.
Registration officers for the contributory health scheme were on hand with their devices, registering and capturing biodata of patients into the central database. Their ID cards are subsequently processed at the head office and sent to them.
I thank the government for giving us the free health center here. At last, many have saved by this hospital, and I thank God for providing job for we here. So we have registered up to 800 people in this community.
33-year-old Salome Godwin, a mother of 7, a hairstylist by profession from River State but residing in Warri, had to travel all the way to the health center in OKOWA'S to circumcise her twin babies right in the village. Her joy was infectious as she spoke with Smart Delta crew.
Hospital that I gave birth, they said to circumcise is 5,000 naira. I said no, I can't circumcise in 5,000 naira each person. Let me go to the village. So we have hospital that they used to treat everybody free. That's why I came to this place. I say thank you to OKOWA and everybody that supports us in this place for giving us free treatment.
Abie Morrison is 26-year-old and a mother of 2. She tells a story of how she almost lost her life as a result of wrong diagnosis from some quasi-health institutions. Thankfully, that is all history, as she and her sister, Priye Oluba, are happy Governor Kowa brought healthcare to their doorstep.
The surgery was successful, and what they could not find outside there, but here in OKOWA'S, in my community, they found it, and I'm very happy.
I'm so happy now because what we couldn't find out there in Warri, because we spent a lot of money, close to like 100 on this, and they were not able to discover it. And when we came here, it was once. Thank you, OKOWA. Thank you, everyone that supported this thing. I'm so happy.
Mr. David Ayebo, who lived with the pains of hernia for 19 years as a result of paucity of funds to carry out his surgery, is all smiles today as the surgery has been done as an enrollee in the scheme. He and his wife are still in wonderland that this miracle, as they called it, could happen on mere 7,000 naira annual premium. Now he is fit to get back to his fishing business.
During that time, by this time, you see me, sometimes I'm feeling cold. But now, all my body is very so sad now. I don't feel anything in my body.
So far, the center has carried out several surgeries and general treatments of prevalent cases such as malaria, upper respiratory tract infection (URTI), and scabies. While for the elderly, cases of hypertension, arthritis, ulcers, and many other ailments are being adequately handled in the center.
Under the Governor Kowa Smart Agenda, I think this is one of the smartest programs I've seen in Delta State government. The surgical breakthrough that we had here, something that has never happened before in this kind of community. And when they heard of it, when they saw it, they were so amazed. And when they went to the community, word started spreading. And ever since then, the turnout has been very impressive.
It is interesting to note that in such a short period of carrying out full medical operations, the center can boast of almost 1,000 patients, and about 80 to 100 of them are attended to on a daily basis.
We work 24 hours here. You can see that there are many people. If they come in the midnight, we can attend to them.
It is also noteworthy that the medical staff of the health center have been adequately trained to handle a wide range of ailments and all emergencies that may arise. Added to this is personalized care and attention being given to everyone who visits the hospital, who in turn take the news to other members of the community.
I want to use this medium to thank the government for the provision of the health facility over OKOWA'S community. Many of them, they don't understand English, so if the doctor is attending to them, he might call us, come and explain to this mama. I will help them to explain.
When I came here first, I said, these people are suffering, but I said, thank God for governor that remember these people, because some people, they have BP of 200, 110. I imagine when this hospital is not here, what would be their hopes? I thank God because he has saved many lives here.
Just like in Polobowo, the women in OKOWA'S also have this myth of not giving birth in hospitals. Today, this is fast changing as the awareness being created by these medical officers in various public places and the testimonies from beneficiaries have helped to change the narratives.
Our standard demographic analysis is that there is a very high child mortality, children below 5 years, in this community based on some of their beliefs.
While the riverine communities no doubt pose a challenge, the upland communities are by no means any easier. So it is heartwarming that these efforts are being replicated in the upland communities too. Primary health care centers here have all been revamped, and are running optimally to the people's benefit.
I am very, very happy to have this hospital. The benefit is very, very good. I've taken the treatment free of charge, so I'm very, very happy.
Majority of the persons here, they are low-income earners. So this contributory health scheme will help them to improve their health in so many ways.
If one cannot pay for his health care with insurance, there's already solidarity. He'll be able to pay. He comes here, he gets treatment without spending a kobo. It's a very good impact on the community.
Without any iota of doubt, Governor Arthur Ifeanyi Okowa has brought prosperity to every Deltan in no mean measure and has put machineries in place to sustain it moving forward.
Come to Delta State, come and see the good things where Okowa they do. You better run, come to Delta State, come and see the good things where Okowa they do. I see a job and work creation in Delta, make the youth say them higher. Okowa, I see good roads everywhere in Delta, make the people say them cola. Come live in Delta, say me I say, come invest in Delta. Come explore the potentials of our state.